For a long time, randomized controlled trials have been considered as the gold standard in evidence synthesis when it comes to medication approvals or approving new treatment approaches. A randomized controlled trial has an intervention group and a comparator group. The intervention group receives that specific medication being tested, while the comparator group does not. Outcomes in both groups are compared and measured after a period of time, and efficacy of a drug or superiority of a drug is established if the intervention group performs significantly better in terms of outcomes than the comparator group. But do you know that there was a period in time when RCTs were not conducted? And one of the most commonly used drugs that was approved without a randomized controlled trial is acetaminophen. Commonly known by the brand name Tylenol, acetaminophen, of course, is sold by other manufacturers as well. It was approved without a randomized controlled trial back in the year 1950. And this was done basically because it had been in use for so long as an effective pain reducer and fever reducer. In fact, acetaminophen has been in clinical use for pain reduction and fever reduction since at least the year 1893. Since the year 1893, you can see these are the names of the German physician who found the antibiotic fever-reducing effect of acetaminophen. That article is actually available for people who are fluent in German and who can read German. So, which brings us to the question, when was the first randomized controlled trial actually conducted? It was conducted in the year 1948 in the United Kingdom to test the efficacy of streptomycin for the treatment of tuberculosis in the lung, for the treatment of pulmonary tuberculosis. Now, of course, for TB, we have a multi-drug approach, but that was the time when antibiotics era was just being ushered in and newer antibiotics were being tested. So that was the time when traditionally, for treating or managing tuberculosis, the best options available were sunshine, bed rest, and fresh air. So, streptomycin in the trial was compared against bed rest. The intervention group received streptomycin, and the comparator group received only bed rest. The intervention group actually received streptomycin with bed rest, and that was compared to only bed rest. Now, here's the more interesting thing. Today, there is so much emphasis on finding positive results, out of a randomized controlled trial, and people feel very upset if the result is negative, if the newer drug being tested is not showing superiority in terms of efficacy, if it's not decidedly better than established treatments, and people feel disappointed. However, the first RCT that was conducted in history on streptomycin actually yielded negative results and was stopped prematurely. The trial was initially supposed to last for 6 months. It was stopped at 4 months because it was found that the intervention, streptomycin, was causing harm as patients, after initial improvement, were turning resistant to the drug. So the tubercle bacilli could be cultured again after a period of time in these patients. So clinical research is fascinating.